any of that?
For treating frozen shoulder, you would do all these stretches?
Exactly. What happened with him is that he had tried the traditional physical therapy for about a year and a half. He had cortisone injections. He had physical therapy. He took NSAIDs, pain narcotics, all of that for the tradition. He even had traditional aquatic therapy and land therapy. So he went through the whole gamut. And then on his third session, he told me he was 85% improved. So after his third session, he was able to throw a ball with his son that he hasn't been able to do for years. 3 years, something like that. Year and a half, sorry. Year and a half with him. Year and a half old. But frustrating enough because his son was playing baseball and he was playing competitively and he wanted to be able to play with his son. So he was extremely grateful that he could get back to it so quickly. The third and final person I'm going to tell you about is a person that came to me for a fitness-related injury. She just kind of felt the shoulder kind of twinging as she was working out and started getting frozen over time. And then just 2 or 3 sessions again, she wrote me a beautiful letter about how, she was able to finally get back to playing golf, but if I could just help her swing, find her swing, it would be great. 3 different ways that AquaStretch can help, 3 totally different diagnoses, but ultimately it all ends up with the same outcome, which is efficient, effective, less painful functional outcomes. So again, thank you guys so much for coming, and I'm excited for you to try. And if you didn't bring your suit and you want to try it and you want to go and get it and come back, we're going to be here until 4 o'clock today. So I would encourage you to do so. I have great hands with me today. I have Carolyn, my PTA student, and then Holly, who has already started her AquaStretch training. So there is 3 of us available for you today if you'd like to experience that. Again, thank you guys so much, and I'll take any questions you have. A patient has a serious condition like fibromyalgia, for example. I'm not going to fix fibromyalgia with myofascial release technique. Those symptoms are eventually going to come back, but those patients get mobile enough to and intuitive enough in their own bodies that when they start feeling stiff, they'll come here to prevent the further stiffness, and so they can just kind of manage their symptoms a whole lot better without the pain narcotics, which is keeping them driving in that vicious pain cycle. So it's very exciting when I can hear that they are coming off those pain meds. And very exciting to watch the word of mouth referrals come. I mean, people will really literally pay for what works. And these patients, half of my practice right now is 50% wellness patch base.
Patients that are fearful of water, for one, how do you kind of handle that? And then she said that pretty much from the get-go, the patient starts moving in the pattern that they need to move. Well, you and I both know how some patients are not very coordinated and have a difficult time moving on top of fear of water. So how would you handle that? How many sessions would it take for you to kind of work through that to actually be able to get in and start delivering some of the effective treatment?
Very good question. And it's twofold. If it's extreme fear of water, I wouldn't even bring them in here, because what are they gonna do? I'm so scared.
Yeah.
They're
Even
gonna
though
tense,
put their
it's kind of
feet on the
productive.
bottom, they just really can't get up.
It's contraindication. If they're fearful of water, it's extreme fear of water, I'm sorry, this is not for you.
Okay.
You know? But it's not to say that I wouldn't try, because if they really, really, really needed it, I would probably try doing some buoyancy equipment, noodles, like kind of put some belts, a buoyancy belt on people. You know, there's some people that come in here with strokes, and so they can't even grab on to the side of those sides. And so we'll have to kind of either have another assistant there to support them, or kind of rig up some other equipment to kind of keep them on the wall there. Sounds terrible, but it's safe.
Exactly.
But then again, you're talking about the traditional, heavily calcified, usually general male patients that come in that aren't your typical intuitive person. And yes, I have a lot of those clients. And so that just takes a lot more education and maybe some more passive
Passive to begin with.
to
probably,
begin
right?
with, yep. And I still, one particular client, he's been coming to me for years, and I still can't get him to move with me. So, I mean, there's just some people that just can't get that intuitive movement, and then you're relying a lot on your tools in your back pocket as a PT and PTA to kind of remember how that joint mechanic was working and how what it's supposed to be doing. And you can add intentional movement then, so it's not directly intuition, it can be intentional. And you can also use gravity too. So for example, they're not feeling pain in the water, but you know that they feel pain when they go lift their leg up land. I will actually have them get out of the pool, show me where they hurt, and then come back in and replicate that movement, because sometimes the leg just doesn't hurt like it does in the water. So yeah, just education and more education. And peeling back layers.
Some patients who start off fearful of the water find they have such great benefits from the therapy that they become more relaxed and they trust us more and keep coming back for more because it works.
So do you do, like if two people are in the water, I mean, one person's in this corner, so, I mean, that's huge if a patient knows that they can get their feet down.
Right.
And then that one kind
Yep.
of mimics that.
Yeah, and that one's pretty deceiving. It looks scary, but it's actually very shallow. It's only 3 feet when you're standing on the platform. And so, you know, they're actually more comfortable up there because it's shallower than in the corner over here.
So I have one more question. How does this relate to Watsu, if it relates at all?
Watsu is passive. So the difference between AquaStretch and Watsu is that this involves the patient's intuitive movement, so they're already starting the movement, and then accenting and the application of stretch resistance is the biggest 3 differences there. Stretch resistance is the application of weights and your manual pressure with their dynamic movement. So in Watsu, they're passive, they're being treated. These people are treating themselves in a sense.
Okay.
Great question. Anybody else? Yes, Nina.
So you referring to traditional aquatic. So if somebody gets a referral for aquatics, then is this not widespread enough that the assumption would be they're probably not doing this kind of technique, that they are probably doing something different?
Correct. Yes. Thank you for tuning in today. I really appreciate you taking the time to learn a little bit about AquaStretch. I hope you found this very beneficial as far as the way to apply AquaStretch therapy, and hopefully you will be able to apply that throughout your rehab clients, fitness clients, and wellness clients. And it's an exceptional modality to alleviate chronic aches and pains and to restore mobility in such a wonderful way. And I thank you so much for joining us today. Thank you for MCC PTA students for joining us and participating, and for all your wonderful questions. Have a great day.